Hi and welcome to today's video. We're going to be discussing fibroids today, also known as myomas or leiomyomas. So fibroids are benign tumours made of smooth muscle cells that grow in or around the uterus. They affect a significant number of women, especially by the age of 40, but many cases are going to go unnoticed. They can vary in size from microscopic to several pounds in weight and can either be singular or clustered. Now, in this video, we're going to explore the causes, the symptoms, and look at some of the conventional and herbal treatment options. Around 20 to 40% of women will develop fibroids by age 40, and 17% of those are likely to have a hysterectomy due to the fibroids. Now, fibroids typically shrink after menopause due to a decrease in estrogen, unless they are influenced by xenoestrogens. These are chemicals that are found in plastics and pesticides that mimic estrogen, and they are in our water, they're in our foods, and it's one of the reasons why we try to filter our water or go organic. Now, there's different types of fibroid. Fibroids can grow in different areas, and their classification depends on their location. So there's the submucosal, which grow beneath the uterine lining. There's the intramural, which develop within the muscular wall of the uterus. And there's the subserous, which grow on the outer surface of the uterus. Fibroids can also occur in other locations like the cervix or between the uterus broad ligaments. And there's a hormonal involvement. Fibroid tissue has an increased number of estrogen and progesterone receptors, making it highly sensitive to these hormones. Other factors that contribute to fibroid growth include xenoestrogens from plastics and pesticides, early menarche, going through puberty at an early age, fewer pregnancies, or obesity will also increase risk. Hypertension, PID or pelvic inflammatory disease, and intrauterine devices are also associated. Interestingly, fibroids are also associated with an imbalance of insulin-like growth factor, IGF, which can increase when estrogen levels rise. Now, the symptoms that you are likely to have, most people are asymptomatic, but symptoms do occur and it will be associated with heavy bleeding. This is called menarche, or pelvic pressure, the feeling like everything is about to fall out. Frequent urination, constipation, or pain during sex can also come with it. Now, in some cases, fibroids can also cause anemia due to the excessive blood loss and clots, and that can lead to fatigue. So it's important that you address the symptoms, but you also want to understand what the root cause is. Now, the diagnosis is usually often discovered during routine pelvic examinations, especially if they're large enough. They might be felt on palpation. They can be found on ultrasound and MRIs, which are used to confirm smaller fibroids and assess their location and their size. Like conventional treatment for fibroids focus on managing the symptoms and reducing their size. So they're going to offer hormonal treatments like GnRH analogues, which reduce the amount of estrogen in your system and the amount of estrogen that your body will produce. The COX-2 inhibitors to reduce the inflammation and the pain. And then we're going to look at surgical options like laparoscopy, pelvic ablation, or even hysterectomy in severe cases. Now, these treatments often have side effects, and the recurrence of fibroids is common after stopping hormonal therapy. So it's something that you might only want to consider if it's close to menopause itself. Now, let's explore some of the herbal treatments. The herbal priorities would be to reduce the amount of inflammation in your system, reduce pain, and reduce the size of the fibroid. We want to address your hormone imbalance, particularly working on estrogen, and we want to support liver function because the liver is responsible for excreting and processing hormones. Some key herbs that are used in this would be turmeric, frankincense, and flaxseed to reduce inflammation, crump bark, which is helpful to release pain, and chasteberry, black cohosh, and licorice to modulate the hormones and increase the amount of progesterone in the system. Additionally, herbs like milk thistle, chelidonium, and dandelion are helpful to support the liver and hormone excretion. Now, dietary changes are essential for managing fibroids. So a diet rich in soluble fiber, including oats, legumes, vegetables, and seeds, help the body eliminate excess estrogen. Probiotics and fermented milk products also support the gut health, which plays a key role in hormone balance. Consider avoiding red meat and processed foods, caffeine and alcohol, and sugary or refined foods which worsen inflammation. Additionally, drinking lemon balm, chamomile, and peppermint can help ease cramping and provide relief for digestive symptoms. Now, when it comes to herbal treatment for some of the symptoms such as heavy flooding or heavy bleeds, then I would use a mix of herbs including yarrow, shepherd's purse, lady's mantle, cinnamon, wild yam, and crampbark. And I would take about a teaspoon of that every 15 to 20 minutes until the bleeding subsides. I'd also include some bitters to try and help support the liver. So chelidonium, gentian, and berberis are quite helpful. And you would take those before meals. Moving on to supplements. So vitamin D and B6 are helpful to support the immune system and the hormone balance. Magnesium and zinc to help support the liver. Calcium D-glucarate for hormone detox, and DIM or I3C, which is found in cruciferous vegetables to support estrogen metabolism. NAC, N-acetylcysteine, is another excellent supplement for reducing inflammation and supporting the liver function, and I would use that with maritime pine bark. In summary, fibroids are a common condition that can cause significant discomfort and impact your quality of life, but they are manageable. So whether you choose conventional treatments or herbal remedies or a combination of both, it's important that you find a plan that works for you. If you wish to contact me directly or make an appointment to come and see me, you can do so through the Wild Sage at proton.me or go onto the website at thewildsage.co.uk. To get any of the information or herbs that you're looking for, or to book a consultation. Thank you for watching. Hopefully you find this useful and helpful. And don't forget to like or subscribe any of the videos and pass it on to someone who may benefit from the information. I'll see you soon.